Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Brain pathway discovery sheds light on higher depression rates in teenage girls. Depression is a mental health condition that affects 280 million people worldwide. It is twice as common in women than men, and this pattern starts to develop during adolescence. Researchers have studied the biological processes that drive depression in adults and shown a potential role for the kynurenine pathway. But this is the first time it has been investigated in adolescents in relation to biological sex. This study was published in Biological Psychiatric using blood test. The study assessed the levels of kynureninic and quinolinic acids in a group of 150 teenagers from Brazil aged between 14 and 16. The teenagers developed to one of the three groups: those with low risk of depression, those with high risk of depression, and those who had been diagnosed with depression. Risk was assessed using a measure that had been developed as a part of Identify Depression Early in Adolescence project and considers a range of factors. There were 50 adolescents in each group, and they were evenly divided by biological sex to explore differences between male and female adolescents. The adolescents were tracked over 3 years to assess if their depression symptoms persisted or improved. Blood tests validated for early Alzheimer's detection in Asian populations. A study in Alzheimer's and dementia, a leading journal in dementia research, has demonstrated the high accuracy of plasma p-tau217 as a blood-based biomarker for detecting abnormal brain beta amyloid pathology, a hallmark of Alzheimer's disease. More significantly, the study validates its effectiveness even in individuals with cerebrovascular disease, which is highly prevalent in Asian populations. This finding can enhance early diagnosis, improve patient risk stratification, and facilitate better clinical management of AD in diverse populations. Brain amyloid status on amyloid PET scans was assessed along with the plasma ALZ part p-tau217 assay to derive 3 range reference points for PET A-beta plus based on 90% sensitivity and 90% specificity. The results showed that plasma p-tau217 outperformed routine clinical assessments and other plasma biomarkers. The high-risk group showed significantly higher rates of cognitive decline than the low-risk group. Study links increased chest X-ray use to earlier lung cancer detection and better survival rates. A groundbreaking study has revealed a significant link between the frequency of chest X-ray referrals from GPs and earlier diagnosis and improved survival rate for lung cancer patients. The study, published in the British Journal of General Practice, found that patients attending practices with the highest chest X-ray usage were more likely to be diagnosed with lung cancer at an earlier, more treatable stage. The practices with the highest chest X-ray usage also saw patients less likely to be diagnosed at the later stages of cancer, stage 3 and 4. These patients were also shown to have better survival at both 1 and 5 years after diagnosis compared with those with lowest chest X-ray usage. Lead author of the study, Dr. Stephen Bradley from the University of Sheffield School of Medicine and Population Health, said, "Lung cancer remains the leading cause of cancer deaths both in the UK and globally. This is an important step forward in our understanding of how to improve lung cancer detection. By encouraging greater usage of chest X-ray, we can potentially diagnose lung cancer earlier when treatment is more likely to be successful." That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.